Here at Sinai, we do the ActiveCare on hip and knee patients. I've seen over 100 cases of patients here with ActiveCare. Basically, this is an 18-room unit, and generally we see anywhere from the 18 to, I'd say, 50 patients a week. And out of those, I would say anywhere about 30 of them a week or more wear the ActiveCare. I believe the ActiveCare is easier on especially the elderly when you use it instead of things like the anticoagulants that they have to take as a pill and then possibly get a blood draw for later on. It makes it easier because they don't have to go out of the house to go to a lab. It's not, with those, you have the possibility of your labs not being routine, and then you could either over-medicate, under-medicate. You have to keep adjusting. With the ActiveCare, it's so much easier because it's just something that they can wear at home. They don't have to leave the home for it. And it doesn't, I think, create the major bleeding risk that some of the other medications can have occur. I've seen patients, as I say, because the blood, either it's too thin, it's too thick, they have to keep adjusting the medication, and they don't have to do that with the ActiveCare. Even though it does, of course, help prevent major bleeding risk, it doesn't cause major bleeding risk as the medications can. One of the major benefits I see from it is the prevention of clots. A lot of our patients post-op are in a lot of pain. They don't want to move around a lot. Many of them, especially the elderly, are either chair-bound or bed-bound. So for those that are not going to be active, ActiveCare, I think, helps them majorly because it helps prevent the blood clots. It increases the blood flow to the limb. So for those, as I say, who aren't going to move, I think it helps them a lot with preventing their DVTs and major bleeding complications later. ActiveCare doesn't really prevent mobility of the patients. They, of course, can put the strap on their shoulder. We do encourage them to keep it on as much as they can, they don't have to disconnect to go to the restroom or go wherever. They can just put the strap on and carry it and take it with them. So we do encourage that they do that as much as possible. The ActiveCare allows the patient to move around more comfortably, other than some of the one of the other brands that we were using in conjunction with the hose, because that's heavier. It's not portable. It is portable in a way, but it does, as I say, it's more cumbersome. The ActiveCare, as I say, they can just put over their shoulder and take it with them. The other does not allow that because it doesn't have that type of attachment. With the ActiveCare, of course, it moves with you if you're going to turn over in bed, anything like that. So it is more comfortable for the patient to wear the ActiveCare, and as I say, less cumbersome. I do think that they are more safe in that the straps and the cords are adjustable. Some of the ones we use here, have used here in the past in the hospital, the straps are long, and actually there has been, I think, a few incidents of even of staff tripping over the lines. So the ActiveCare is more comfortable in that manner. It's safer for the patient because, as I say, they can adjust it to their height and everything. I find the ActiveCare more convenient for the staff and mainly for the patient. Many patients don't want to have multiple blood draws because of the discomfort with the stick. With the ActiveCare, we don't have to do a blood check to see if it's therapeutic, and many of the patients appreciate that. So the ActiveCare, we show them once they're shown how to use it, and we hook them up. Many of them just get up if they have to go to the bathroom, with it themselves. With the other type of different apparatus we were using in the past, the patients would always call us to come and unhook them, come and hook them back up. So we don't have to do that with the ActiveCare, so it takes less of our time as far as that. But as I say, I think the major benefit for us and for the patient is the fact that we don't have to monitor them as far as the constant blood sticks. Sometimes even on the anticoagulants, if it's not therapeutic, then the patient has to be stuck once, twice a day with that, and that is a major discomfort for them. I believe with the ActiveCare, they are more likely to have compliance with it because, as I say, with the ease of it, they don't have to take it on and off, they don't have to unplug it. Sometimes I find that people, when you give them a medication to take, and that's always one of the I think the drawbacks is you're not always sure of the compliance with the checking the therapeutic level of it. Many people, and it's hard when you're not in the health field, don't realize how many people won't necessarily be compliant with that because they don't like to be stuck for a blood draw. So, and plus they have to many times go outside of the home to do that. So they may not be as compliant, especially depending on weather and things of that nature. And with the ActiveCare, you don't have to be concerned with that. It's, as I say, it's already there in the home with them. When they get ready that they can go off of it, things are supplied for them to have it picked back up, or the ease of returning it. So they are more likely to have compliance with it. Yes, I would, and actually I have put the ActiveCare on myself to see. I always like to know what it feels like that a patient is getting. So I find it actually soothing to have the rhythm of it, squeezing, letting go, squeezing, letting go. So I would recommend it to patients, especially, as I say, those who I feel are more likely to be inactive, who won't get up and walk around, to have that feeling that they're not going to get a DVT or a blood clot, have major bleeding risk. So yes, I would recommend it to patients. Yes, I do think the hospital would be wise to use ActiveCare. Anytime a patient has had any kind of surgery, they run the risk of getting a blood clot or a DVT, and not just in orthopedic surgery, in any type of surgery, to help the patients go home with at least a more secure knowledge that they will have a better chance of preventing a blood clot or major bleeding risk from any kind of surgery. So I would recommend that the hospital use it.